I'm Barbara Nevins Taylor. If you're the caregiver in your family, you are not alone. More than 43 million Americans take care of someone over the age of 50, according to the Family Caregiver Alliance. It's a tough job, and I know it because I took care of my mom and an older cousin.
Caregiving is a special challenge that leaves people fairly isolated. It takes them away from their friends and their families. It has them doing a lot of extra legwork, finding services, getting services, delivering care.
Faye Radding with the MetLife Mature Market Institute says their surveys show women are most likely to take on the job.
Well, women are more likely than men to become caregivers. We know that the average caregiver is around age 44, likely to be a woman, and likely to be employed, and likely to be a caregiver for 4 years.
Geriatric care manager Joanne Lehman runs a caregiver support group.
We have to learn to take care of ourselves first, not to burn out caregiving.
That's why it's important to develop a strategy before crisis time. Talk about money and have the difficult conversations.
You say, Mom and Dad, I want to make sure you can live in your home independently for as long as you want. We want to make sure you get the most care that will be beneficial to you. But in order to do that, we need to make sure you plan properly.
That may mean setting up a trust or transferring assets. There's more about money management in our 55-plus planning video, but the basic idea is to maximize what you have.
What we want people to do is be able to get the care they want, be able to supplement what otherwise would be available through government programs, and maintain a standard of living, and also be able to pass assets through to the next generation.
Find out what your parent or the person you care for wants to do.
If the caregivers are fortunate, meaning that their loved ones come to the realization, gee, I really cannot manage my own home.
And that's what happened to Dr. Monty Malik. He moved into the Hallmark, an assisted living facility in Lower Manhattan, 7 years ago.
I felt as though I needed to have companionship of people of my vintage. And my daughters found this place, and I enjoy it very much.
Many are unwilling to make that leap.
Of course, people are resistant. They don't want to give up their independence. So it can be a really big help to have a healthcare professional make a suggestion.
A family doctor, a social worker, or a geriatric care manager can help. The National Association of Geriatric Care Managers website offers a search tool to find someone in your area. State and local offices of aging are also good resources because the federal government provides grants to states to help with some services for older people. And there are other websites.
Benefitscheckup.org is something that will help people all over the country put in the information about their parents and find resources in their communities. It's important to know whether you can get a service from Medicare.
Everyone over 65 qualifies for Medicare health insurance. Medicare Part A is free for most people. It covers hospital stays.
Medicare is not really a program that's intended to pay for nursing home costs.
Part A does cover limited nursing home care if someone is transferred from a hospital to a nursing home for rehabilitation.
What people typically need when they go into a nursing home is what's called custodial care. They need help getting out of bed, eating, getting to the bathroom. Those are not services that are intended to be covered by Medicare.
Part A does pay for end-of-life hospice care. It also covers limited at-home care if medical assistance or rehabilitation is needed. Medicare Part B requires a premium. Most pay $99.90 monthly, but costs rise according to income. Part B covers a portion of doctor's visits, outpatient services, medical devices, some home health services. Medicare Part C is Medicare Advantage, managed by private insurers. There's a monthly premium, and it covers some things Medicare A and B do not. It may cover prescriptions, vision, and dental, but it restricts you to the doctors and provided in specific networks. Medicare Part D covers prescription drugs. It's run by private insurance companies. The costs vary depending upon the plan, the drugs, and whether you use a network or the pharmacy of your choice. Medicare supplemental insurance plans are also called Medicare Gap plans because they cover expenses Medicare doesn't pay. You can choose your own doctor or provider, and you can combine Part D with a supplement to lower costs, but the monthly premium is high.
Supplemental insurance is very important because Medicare Part A and Part B basically are covering hospitalization and You want to have Part B for doctors, and supplemental insurance covers all kinds of extra copays and premiums that are not covered through those programs.
Medicaid is the backup if you run out of money, but there is an income and asset limit. The amount is set by your state.
Once you are able to establish Medicaid eligibility and get through the application process, your unreimbursed medical expenses will be paid. You can qualify for nursing home care. You can qualify for care in a nursing home, and you may be able to get community-based care in your home.
It is also possible to get Medicaid assistance for at-home care, but again, this may require advanced planning. Figuring all this out and helping an older person is exhausting. That's why experts recommend support groups.
And depending on the intensity of care, it can lead to a lot of burnout and higher health care costs for those caregivers who are not getting what they need for their own health and well-being. So support really improves our own well-being.
The Family Caregiver Alliance offers a navigator to help you find groups in your area, and the federal government's Elder Care Locator can point you to government agencies that may help. One last thing, because women tend to be the caregivers and live long lives, it's important to take care of yourself.
So a woman caregiver needs to give special consideration to how she can stay in the workplace, continue to add to her own retirement accounts, even as she's a caregiver.
There aren't easy answers here, but planning, networking, and sharing problems and solutions can ease the pressure. But most importantly, don't wait until there's a crisis to make a plan. Waiting can cost your loved ones money and important care.